Testing is integral to Badger Bounce Back. We've all heard this from the national media from the very beginning of this crisis. We need more tests, and they're right, and here's why. Even though we have done an outstanding job of flattening the curve by staying safer at home, we are all still susceptible to COVID-19. So to make it safer to leave our homes, we need to substantially increase testing, so we know who has COVID-19, and we can make sure that ill people and their contacts who may be incubating the disease continue to stay at home until they're through that incubation period. It's about isolating or boxing in the people with the virus rather than isolating and boxing in all of the people. So taking our lab capacity from the ability to perform 0 COVID-19 tests in early March to nearly 11,000 tests per day now is one of our success stories here in Wisconsin. But capacity is not the same thing as utilization, and we have some work to do here. Currently, we are using between 2,000 and 3,000 of those 11,000 tests per day. The most important thing for the residents of Wisconsin to know is that we are increasing to testing, and that anyone with symptoms should contact their healthcare provider and ask to be tested. This is a big change in the guidelines for our healthcare providers when it comes to test access. Only a month ago, we told them that they should only test the most ill people due to the shortage of testing supplies. We've recently updated our guidelines to encourage this widespread testing, and we acknowledge that it's a big shift, which is why we have a team here at the SEOC working with healthcare providers. Clinics that would typically counsel people to take care of symptoms at home so they don't bring infections into the clinic are now being asked to change from an individual health focus to a public health focus, and that means bringing in more people to test. But testing alone is not enough to contain the virus. Another key part of Badger Bounce Back is tracing every one of those positive tests. This means that we contact everyone who has a positive test, and in fact, we are moving to contacting everyone who has a test, even before they know the results, to let them know they must isolate at home until their test results come back. And then if they are positive, they need to stay at home until they are symptom-free for at least 3 days. We also need to identify the person's close contacts who are at greatest risk for developing COVID-19 and spreading it to others, so that we can tell them to quarantine at home for 14 days, that period of time when they may become sick. Contact tracing begins with your local health department, and because of the increasing workload, the State Department of Health Services has also been supporting many local public health departments in this endeavor. To help with their workload, DHS has trained 259 contact tracers from our own department and other state agencies. These contact tracers are currently working in the field, and we are onboarding 78 more, plus an additional 50 who will start training this week. Our goal is to have 1,000 contact tracers between the DHS surge capacity and the capacity of local public health departments. We are also investigating ways that technology can assist us with this very big task. Just think about what we're aiming to do. If we conduct 85,000 tests per week, and 10% of them are positive, as we're seeing now, we will need to interview 8,500 people. And if each of them has 5 contacts, that's another 42,500 people to call. We're not there yet, but we're making progress. Just like Badger Bounce Back is an interconnected plan, the SEOC is doing work that is interconnected with the work you are doing by staying safer at home. By limiting trips to only going out for the essentials and physical distancing, you are all working to flatten the curve, just as we are taking actions like expanding testing and contact tracing to make our community safer once we begin to open up more businesses and services. Thank you for your partnership and for all of your hard work.